My name is Henry Vernov. I'm currently a product manager for healthcare vertical at Citrix.
My name is Craig Richardville. I'm the Chief Digital and Information Officer at Intermountain Health.
Craig, as you start expanding your horizon, not only caring for the clinician, but also looking more holistically with patients, how do you engage patients more effectively? Because again, getting a response from a patient to a scheduling alert or getting them come in for any test, it's a challenge, right? You might have all the technology in place, but if it's not being consumed, it's hard to achieve the desired outcome. So from your perspective, how do you engaging with patients for them to adopt the technology?
Well, to engage with our patients, and I'll actually include members in that conversation, is really a personalized approach. So for those that may have more advanced in the digital world, will want to communicate with them through emails, communicate with them through texting, through chatting, nudging them, really kind of making sure that we continue to remind them when maybe an appointment is coming up, or if they have a certain annual exam that's due or overdue, and the way that they want us to communicate with them. And for others, it may be more voice, maybe calls, it may be allow people to have our contact centers, and either talking with people or talking with machines. We've got some advanced technology that when people do call our contact centers, that it really intercepts and tries to deflect the call to the person and helps in a very mechanical way of how we want to process that interaction. If it is complicated enough that the machine can't do it, to make sure that there is a person available to him or her for that. So it's really just staying engaged, but not overdoing it such that where people want to use the classic stop, and then you kind of break it down to zero. So you want to make sure you continue to ease it, as well as we have a great partner in our engagement with a company called Qualtrics, and they listen to a lot of what's happening in the social media. They listen to calls and the chats that go back and forth, and they provide a lot of guidance for us to be able to make sure that we're given the appropriate response that that patient would be wanting to receive. So it's really all about just kind of those continuous touches, but it has to be personalized to each individual. You may want to be touched a lot different than how I do. I need constant reminders. I really want to be reminded. Others may use their calendar just fine and not need those kind of nudges, but to be able to stay in that constant contact is important.